Hello, everybody. Here is Tatiana Bazzichelli from the Disruption Network Club, and I'm very happy to introduce this conference, Behind the Mask, Whistleblowing During the Pandemic. At this conference, we invite experts that have been speaking by denouncing abuses and wrongdoing in the course of COVID-19 crisis and beyond. Together with me, I have a really great group of speakers, but first I would like also to thank the team of the Disruption Network Club that made this conference possible. So together in my same place, I have with me Lieke Ploeger, that is the co-director of the Disruption Network Club. She is going to present also after me what is going on in the next days. And then I want to thank Elena Velianowska and Nada Baker that are working on the production, Jonas Franchi on the graphic, Alanna Travers on the communication, Claudia Trapp on the press, and the Boiling Head Media Group for the streaming, and Francesco Mancori for the lights. So, speaking about the program of today, we start with this panel with the title Digging Deeper into Healthcare, the Vaccine Rollout, Pandemic Journalism and Corruption. And the panel focuses on the need of transparency in the pharmaceutical industry in the context of the debate around the corruption and the COVID-19 pandemic. After, we will have a second panel that is starting at 6:30 Berlin time, Voices of Care, Exposing Dangers in Public Health. With this panel, we will present the direct experience of various experts that are informing on abuses and wrongdoing in healthcare systems. And we will also focus on the direct stories of people that have been working inside these systems themselves. I also want to remind you that until Sunday it's possible to watch, for the people that are living in Germany, the film Coronation from Ai Weiwei. So please just remember to go on our website, disruptionlab.org. There is possible to find the tickets. It's for free, but you need to register. And is available until Sunday evening. Now I'm passing the word to Lieke, that is going to introduce also the workshop program, the funders, and also will tell more about the chat that we have today.
Yeah, thank you, Tatiana. So I will introduce a bit what else is going on after the conference, because we're also organizing 2 online community workshops as part of our community program. So actually tomorrow we will have a first workshop with one of the speakers of today, Serena Tinari, who's an investigative journalist and also the founder of Recheck. And she will give the workshop, Get Your Numbers Straight, Making Sense of Health Data. And there she will teach us how you can develop a spider sense to spot red flags in public health communication and mainstream media reporting, something very relevant for these days. And she will give also concrete examples of the COVID-19 era and tips to avoid pitfalls. So we have a few final spots left for this workshop. So if you're interested to join, you can sign up also via our website. And then the second workshop attached to this conference is happening next Saturday, the 27th of March. And this one is called Pirate Care, Politicizing Care, Piracy and Biopolitics. And in this workshop, we're joined by the people of the Pirate Care Network, and they will teach us more about piracy, the division of care labor, and also civil bio-disobedience. And also here we have a few final spots left, so you can sign up online. And then before going on to our first panel, we also want to give thanks to the funders of our program. First of all, the Senate Department for Culture and Europe from Berlin that is supporting our work, the Riva and David Logan Foundation, the Bundeszentrale für politische Bildung, and the Checkpoint Charlie Foundation. We are also supported in part by a grant from the Foundation Open Society Institute in cooperation with the OSIFA of the Open Society Foundations. And this conference is also part of the Reimagine Europe project, which is co-funded by the Creative Europe program of the European Union. Then we also want to thank our cooperation partner, Transparency International, and the partners that we've been working in collaboration with, which is the Signals Network and Global Leaks. And of course, we want to give a special thanks also to our streaming partner, Boiling Head Media, which is making all the live streaming for this conference possible, and to our media partners, the Berliner Zeitung, Taz, die Tageszeitung, Ex-Berliner, and Il Mitte for helping to spread the word about our work. And finally, also to our outreach partner, which is Axioma. Then just a final thing to remind you of before starting, we also have an online chat, which you can find via our website. And there you can also join and participate and ask questions to the speakers, which we will collect for the Q&A at the end. And please, don't wait till the end, but post your questions at any time and we will collect them. And handing back over to Tatiana.
Thank you, Lieke. So as Lieke said, I will also come back at the end, bringing the questions from the audience. But now let's start with our panel, digging deeper into healthcare. So I'm very happy to welcome here Sarah Steingrüber, Serena Tinari, Alexander Nanau, and the moderator, Jonathan Cushing. So I'm going to introduce Jonathan, and then I will leave him the honor to introduce our panelists. So Jonathan is the head of Global Health Program at Transparency International UK. He works on the Transparency International global movement to reduce corruption and ensure transparency, integrity, and accountability within the health sector. Prior to joining TI, he worked extensively in Bangladesh, Malawi, and Rwanda and Nepal, supporting governments and civil society to improve access to and the quality of healthcare services. He has over 15 years experience working on health system development. So thank you very much, Jonathan, for being with us, and thank you all the speakers. I leave now the word to you, and I will come back later to tell you what the audience is asking about. Thank you.
Thank you, Tatiana, and good afternoon, good morning, everybody. As Tatiana said, we're here today talking about the need for transparency in the pharmaceutical industry and looking at this within the context of the kind of ongoing COVID-19 pandemic and the various corruption scandals that have happened over the past year. As you may have noticed by my accent, I'm based in London, which seems to have been the epicenter of many of these scandals, unfortunately. But I don't want to talk about it. I'd really like to let the three panelists that we've got here today talk about their work and experiences, and then dig a little deeper in the conversation after their presentations. I will introduce the panelists before their presentations. So I'd like to kick off, first of all, by introducing Sarah Steingrüber, who's an independent global health consultant based in Berlin, and her work looks at the intersection of anti-corruption, transparency, and accountability in the health sector. She's the Global Health Lead for Curbing Corruption, an affiliate expert at the U4 Anti-Corruption Resource Center, and a health advisor for the Partnership for Transparency Fund. Over to you, Sarah.
Thank you, Jonathan. So I've prepared a presentation, so if we could bring those slides up, and I can begin. Excellent. So as Jonathan indicated, I'll be speaking to you today about the issues of corruption in the healthcare sector. And I'm going to focus specifically on how this relates to the vaccine supply chain, which of course is a topic that's on everyone's mind today. Next slide. So in order to sort of set the scene, I want to sort of describe first a number of the vulnerabilities to the health sector that we see with regards to corruption. The first is sort of the inherent nature of health systems. No two health systems are in fact the same. Their supply chains are very long, they're very global, they're very complex and interdependent. And so this means that we have many different decision-making points and then of course many different decision makers. That increases the number of opportunities where things can go wrong. The health sector is one that is flowing with money. There's about 7.5 trillion spent every single year on health. And a conservative estimate of that is that about 6% is corrupted. When it comes to public procurement, which is an area in health that takes up quite a lot of the funds that are used. So in low and middle income countries, it's approximately 50% of the entire health budget, and 30% of high income countries that are of health funds that are provided for public procurement. We find that up to 30% of overall contract value is then lost to corruption. And if we look at the service delivery level, Transparency International states that approximately 17% of people across the world have paid a bribe when interacting with the healthcare system. So there's a lot of low-level corruption as well. And finally, a major vulnerability is that anti-corruption, transparency, and accountability measures, or ACTA, in health systems is often ignored, it's insufficient, or ineffective. So whatever methods there are to actually try to curb corruption in the health sector is actually quite undermined by the fact that they're just not very good. Next slide, please. When it comes to the consequences of this, what does it mean? So health systems' purposes are undermined through corruption. They cannot do the thing they're meant to do. The corruption deters people from seeking care out of fear that they can't afford it, such as the bribes and so on. It leads to financial burden and catastrophic loss for individuals and their families, which perpetuates poverty. It contributes to the issue of antimicrobial resistance. It increases morbidity and mortality rates, so we have more people dying as a result. It undermines the achievement of universal health coverage. So if referring back to the statistic that 6% of overall spend is lost to corruption, this equates to about 500 billion every single year, which is more than enough than we would need to actually achieve universal health coverage. It then also reduces public trust in public institutions. So the long-term problem is that people just no longer trust not only the health system, but the public systems more broadly. Next slide, please. When we look at healthcare corruption, I find it quite useful to compartmentalize into the 6 different building blocks of a health sector as set out by the WHO. And so we can find corruption in each of these building blocks. Click forward, please. And so we see in each of these building blocks different types of corruption. In the service delivery component, we see things like bribery, overcharging for services that should otherwise be free of charge. Things like absenteeism, where healthcare workers just don't show up to their post. Things like conflicts of interest between healthcare workers and third parties, such as companies. Things like nepotism and favoritism, where healthcare workers choose to provide services to their friends, their family members, their acquaintances. Things like moonlighting, where a public provider, so physician, might work in a public institution for a certain number of hours of the day or none at all, receive that wage, but then also go and work in a private institution when they should be collecting on the wage when they should be in the private or the public institution. With regards to essential medicines, which will become very important in just a moment when we talk about vaccines, we have issues like lack of transparency in clinical trials, undue influence of companies on the R&D pipeline, and things like substandard and falsified medical products proliferating in supply chains. And with regards to health information, we can see manipulation of data or withholding of data, which is necessary in order to make good health system decisions. With regards to health financing, things like procurement corruption, which I mentioned earlier, or simply embezzling public funds that are dedicated for the health sector. And then finally, at the leadership and governance level, we see things like bribery, conflicts of interest between leaders and corporate entities, things like regulatory or state capture, where the legislation or the regulatory frameworks that should govern health systems are actually influenced by third parties and are not within the public interest. Next slide, please. And then when it comes to a crisis like the one we find ourselves in now with the COVID-19 pandemic, essentially what I just described as far as the types of corruption that can impact a health system, the crisis situation will increase the drivers, it decreases the restraints that should actually curb the corruption or control it in some way. And this leads to an increase in the opportunistic behavior. So people see opportunities to engage in corruption, and this then leads to, obviously, more corruption taking place. Next slide, please. With regards to the vaccine rollout, there are some types of corruption that I think are, or I have identified as being particularly relevant. The first is R&D. Please click forward. And in this area, we see things like abuse of trial funding, or that would certainly be a risk, is the abuse of trial funding. So within the EU, there's been 8 billion effectively dedicated to R&D, 3 billion for vaccines specifically. In the United States, it's 5 billion for research and development. In Germany specifically, 750 million euros have been dedicated for R&D. There's a lot of risk around that this trial funding will be abused. Of course, also a lack of transparency in clinical trials is also a huge risk. So either through improper trial design or conduct, through manipulation or withholding of results, which is something that we saw last year, in fact. And then with regards to the regulatory process, which isn't under the remit of R&D necessarily, but has an influence on it, there could be an abuse of regulatory frameworks as they relate to R&D and conflicts of interest with regulatory authorities that are responsible for approving new innovations. And this is particularly a problem because many of the well-funded regulatory authorities are actually funded by corporate fees. Click forward, please. The second point is on procurement, and this is a serious area of risk, especially with regards to the vaccines. Here we see essentially a lack of transparency as being a major risk, that there are inappropriate direct appointments, that there are rigged specifications for who might get be awarded the tender, and then more traditional forms of corruption such as collusion, favoritism, and nepotism. Click forward, please. Now, with regards to transparency in the COVID-19 vaccine, I would argue that when it comes to the R&D component, that this is probably one of the most transparent R&D processes that we've observed in human history. There's been so much attention and so much interest from the public generally, from the scientific community. There's so much funding going into it. And there's a strong sense of, we need to know what's happening. So it's been very, very transparent. When results come out, they're, very quick to be disclosed. And there's been a very serious and rigorous process behind the scenes at the regulatory authority level. Click forward, please. Now, with regards to pricing and procurement, that's another story. Click forward again, please. So on your left, you will see this is a page out of the AstraZeneca contract when it was originally disclosed, and it's meant to detail the cost of the vaccines that we were receiving. Versus here we have a shower curtain from IKEA. And I don't know about you, but it looks about like the same picture to me. Click forward, please. And again. The reason that this issue is concerning is because of the level of public investment in the R&D process for COVID-19, which I explained before. And I think that the amount of public investment demands that we ask the questions, what about public return on public investment? If I was a corporation and I only, if I was a venture capitalist, say, and I was putting money into a pharmaceutical company, I would expect a return on that investment. But countries cannot do that, or at least that's not the current system. And then the other question is, should the COVID-19 vaccine be a public good because so much investment has been made through public funds? Should this be available then to all? The reason that this is a concern is because it's not being held that way. We find ourselves in a situation where there is vaccine inequity. Click forward, please. And so there are cases, very clear cases of a delay in provision to countries in the global south or paying higher prices. Click forward, please. The reason that this is then a concern is because of this inequity is going to increase the likelihood of scarcity. We know from the COVAX facility that only 20% of requirements are actually going to be able to be provided at this first funding round to countries that are a part of COVAX. This increases the likelihood of scarcity and therefore increases the likelihood of substandard and falsified vaccines in supply chains. We know by looking at other products that this is the case, that when there is an increased demand for products such as hydroxychloroquine or chloroquine last year, that this led to increased detection of substandard and falsified versions pretty much immediately in low and middle income countries. We know that substandard and falsified medical products lead to increases in preventable deaths. We know that SFMPs also increase the costs of follow-up care as a result of them. And this is a serious concern because very few, so only about 30% of national regulatory authorities actually have the capacity to be able to guarantee patients with products that don't cause them harm. So 70% are unable to do this. Next slide, please. And so we see that we are now, there is cases of fake vaccines popping up, and it's going to continue to be that way unless we have vaccine equity. Next slide, please. This is truly a political choice, and this is the last thing I'm going to leave you with, is that it's a truly political choice to not allow vaccine equity, to perpetuate the likelihood that corrupt practices like substandard and falsified medicines is going to proliferate in supply chains. Now, there is something that is already established that we could use to reduce inequity, such as the medicines patent pool. So in this situation, the patent holders, so the big four that we have, the vaccines right now, they could put these intellectual property rights, these licenses, into a medicines patent pool that could then be taken up by generic manufacturers, created at high volumes, at low cost, which could then be provided to patients and still deliver a return on investment for the patent holders. This is done with a lot of different drugs, and it's just not being done with the vaccine, and that's a political choice. And it's not completely unfathomable that major innovation can be handled this way. So if we look at the likes of insulin or the polio vaccine, insulin was sold for $1, the patent, and that was only for quality assurance purposes. And the polio vaccine was never patented by the innovator. And so these are choices that we're making. And it's perpetuating corruption, which is going to perpetuate the lack of or increase public distrust in public institutions. Next slide, please. So to summarize my points here today, I just wanted to say that health systems are inherently vulnerable to corruption, especially in health emergencies like the COVID-19 pandemic that we're all experiencing. The pandemic presents both unprecedented challenges and opportunities to address forms of corruption that undermine health system functioning. Vaccine scarcity, which is one of the consequences of corrupt practices and itself is perpetuating corrupt practices, is a political choice. With it is coming substandard versions of the vaccine that we all need in order to kind of return to normal, whatever that may be. And arguably that this should be at the top of the agenda for the COVID-19 vaccine rollout. There are conversations happening at the EU level right now about waiving intellectual property right requirements for these vaccines to be able to allow for generic manufacturers to produce these vaccines. They will be happening within the next weeks. So any opportunity that there can be for us to raise our voices and to allow these waivers to be put through, obviously is very much desired. So on that note, I would conclude and say thank you for your attention. I look forward to any questions.
Thank you very much, Sarah. And please, if you do have questions, please use the chat function on the website to submit your questions, where the team will collate them and put them back to the panelists later on in the session. I'd like to hand over now to Serena Tinari, who will be talking next. She's an investigative journalist and the co-founder of Recheck, a non-profit organisation working at the intersection of evidence-based medicine and investigative journalism. She'll be talking up next, and she will also be hosting a workshop later on this evening, I think. If you would like to log on and subscribe to that, there are still places remaining. Otherwise, over to you, Serena.
Thank you. Thank you for having me, first of all. And just a little correction, the workshop is going to be tomorrow at 3 p.m. Central European time. We will have a couple of hours to go. We will try to go a bit more in depth in what I will present today. This is, of course, a short presentation. So this is our website of Recheck, and you find us on Twitter as well. And next slide, please. So we are two investigative journalists, and we work with the methods, the tools, and the ethics that are really at the intersection between investigative journalism and evidence-based medicine, so-called EBM. They do share a hypothesis-driven approach, and much more than that. What we learned through the years is that the methodology of evidence-based medicine can be really important for journalism. Next slide, please. So I would like to start saying that for investigative journalists that specialize at health and medicine, this global crisis is quite difficult to handle, especially because even though we have been all daily bombed with numbers and statements, I might say that this could be maybe remembered as the most evidence-free public health crisis of our times. And I will try in this short time to explain you what I mean with that. Because sadly, for many interventions that have been implemented worldwide, we actually don't have really solid evidence. Basically, we just don't know. The big problem that comes with this is that our brain, we really struggle with coping with uncertainty. We are just like programmed. We like to have routines. Look at kids, how kids like to have food at the same time. Also adults, we also function this way. So for public health authorities, it's always extremely difficult to communicate risks, harms, and benefits. And throughout this global crisis, we have been seeing a lot of messaging that is like really pointing on the certainty. We know this, that's how it is. Unfortunately, it's much more complicated than that. So let's go back to the slide, please. So what is the best available evidence? That's the language we use. I will try to not use too much jargon. So evidence-based medicine helps us navigate in this very complex field. This is a very simplified version of what is actually universally known. How do you assess the evidence? What basic methodology you have? Because, I mean, media will tell you a study has shown that whatever. But what was this for a study? So we need a methodology, and we do have science. We have a scientific methodology. So in this very simplified version of the big family of methodology, you will see that the best evidence is on top of the pyramid. And that's a systematic review, a meta-analysis of randomized controlled trials. Now, we don't go into details. We will do it tomorrow at the workshop. And the more you go down the pyramid, the less strong the evidence is going to be. From the cohort studies, you see it in the middle of the pyramid. From there down, we speak about observational studies. And this is a very important word that you might want to keep in mind. And if you go down the pyramid, more down, you will see what is actually considered no evidence, which is experts' opinions, consensus conferences, and clinical experience without proof of systematic evidence. What does it mean? This means that all that is observational, how it's called, it's more prone to bias or confounding factors. This means that it's going to be quite difficult to know, I'm trying to measure something. Is this intervention useful? What are the effects? Positive, negative effects? We know is always a fine balance. When you work with observational data, you are observing something. And we know that this comes with many limitations because there might be confounding factors influencing the result. And this is a really big problem because, of course, also the best standard that we know, that is a randomized controlled trial, can be flawed, can be not really well done, can have many problems. I'm telling you, it's very complex, this field. But at least you have references to know where are you going. So next slide, please. I thought to show you today something. This is a most simple version of this. So the top level is randomized control trials and then all the rest. So during this global crisis, we've been all bombed by a lot of information, and journals are publishing at warp speed. A lot of papers, preprints, not preprints, is quite messy. Next slide, please. I thought to show you something about wearing masks in the general population, honoring the title of this great event that is Behind the Mask. I just want to make clear that I'm not here arguing for anything. I don't do public health policy. Myself, I wear a mask, of course, and I'm not telling to anybody to not wear one. But let's look at what is the evidence of the effect of face mask in the general population. So this is actually the only existing randomized controlled trial. So we have seen that it's considered the best level of evidence. Incredibly, in 1 year of global major crisis, there is only one. This is the so-called Dan mask. It was done in Denmark with 6,000 participants. You might think it's a small number. It's actually an okay number per se. Of course, we could go in many details about the design and so on. Next slide, please. The problem we have is that this is the only randomized controlled trial that has been done during this big global crisis. And the results were kind of depressing because the result, in a nutshell, showed that 1.8% of those wearing masks caught COVID compared to 2.1% of the control group, so the group that was not wearing face masks. Is a difference that is so-called statistically not significant. It doesn't really help us. Let's put it simple, it's not telling us that they are super effective, to put it mildly. It's rather telling us that probably they are not really super effective. This study was published after quite a complex story, but it was then provoking quite some discussions, even though actually it's just like a randomized controlled trial. There are some limitations in its design, but it's not like a bad study. Next slide, please. There is another randomized controlled trial that is still going on now. It's in Guinea-Bissau. Please, next, click forward. As you can see, this is clinicaltrials.gov, where all the studies must be registered before they start. It's a really good source of information. So there are a lot of participants. We see 40,000. Here they are going to compare cloth masks, whereas the Danish study was with surgical masks. We will see what this study will bring. The numbers are really big, 40,000, but we still don't have it. It's apparently still going on. So I find it, as an investigative journalist working in this field, I find this pretty problematic, because I mean, in 1 year, I mean, I understand the beginning of the emergency, you never know, but in 1 year, is it possible that was not done more to really clarify this question? Next slide, please. This is a piece that was published in July, so already quite a while ago, by the Center for Evidence-Based Medicine at Oxford University, and Tom Jefferson and Carl Hennigan made a review. They tried to see, okay, what do we know about the effects of wearing masks in the general population and also on health workers. I must say, considering that until now not much has been done, we are a bit left with those conclusions. Next, please. This is, I suggest you, is not jargon. This paper of Jefferson and Hennigan, I mean, basically, the evidence we had before this crisis, it's about a quite small number of participants, not many studies, and the results are really not exactly exciting. They don't seem to show a really major effect. What we are left with, next please, is actually observational studies. So we know, like on rats in a lab or like with puppets, they tried to measure, but this is not good level of evidence. I want to say something about pandemic journalism that for me is really a big problem, because I mean, these are exactly the questions that journalists should be now asking to government, all governments. We should all be reclaiming the evidence. We should ask why in 1 year you didn't put some money to make some really good and solid study to have more certainty about all this. And this is unfortunately not really happening. We have been seeing in this year, and I'm sorry, but quite a lot of copy-paste. Tatiana before, I think, and also Sarah, we are mentioning transparency. We want transparency from the industry. I fully agree. I also want transparency from governments. And I also would like journalists to ask difficult questions. I don't like this new thing that we copy-paste the press releases of governments and corporations. I don't think this is in the public interest. And this happened all the time. And I think it's time really that this should actually change. We have seen also a lot of embedded journalism. If you can show please the slide again. This is a piece that we wrote. No, we were a bit further. Okay, this one. You can read it. There are many examples. And this happened worldwide. The press conferences of governments became a bit of the Bible. Everyone frantically checking television and trying to get the information. But public health is a lot about uncertainties. It's not about we know everything. So embedded is never a good idea, I think. And there I think we have a problem. Next, please. We have seen worldwide experts becoming VIP, virologists and so on. If you remember, this is actually no evidence. Next, please. We have seen many experts on television and on the media. We see them every day. I just suggest you to think that there are so many different experts, but not everyone is good about, I mean, is really knowledgeable about public health in this specific case. You want to talk to an infection disease epidemiologist, a vaccine safety epidemiologist, and the pharmacoepidemiologist. These are the real experts in this field. Next, please. And this is the last thing I wanted to speak about, is the Ministry of True Science. I recently published an article on the British Medical Journal. Next, please. And when a doctor, a Spanish doctor, made a Facebook post about my article, Facebook labeled it with this, this is in Spanish, it's like vaccines are really truly researched on efficacy and safety by regulators, which is of course true. But I wonder if we all agree that social media are now in charge of what is true science or the best available evidence. Next, please. We wrote a guide for the Global Investigative Journalism Network. It's in open access. Next, please. We wrote it really to try and help our colleagues, because I'm really sorry if overnight they had to become pandemic journalists, but this is a difficult field. So in this guide, there are a lot of tools to try to learn a bit how it works. And now the next slide. I'm here happy to, really humbled and honored to announce that we just launched a global leaks on Recheck website, because we have been regularly contacted by people who want to share confidential information in the field of medicine and public health with us. But we are very concerned about their safety. So with this global leaks tool is an open source software, as maybe you know. People can share with us confidential information in remaining anonymous if they wish so. And this we think is very important, because there is a big need of transparency, and we do need to hold the powerful accountable. And with this, I don't mean only the pharmaceutical companies, of course, I agree, but I think also we need to keep also holding accountable also the governments and the public health authorities, which doesn't mean we don't have to trust them. Public health is all about trust, but we need to ask questions, and we also need to ask difficult questions. And that is it for me. Thank you.
Thank you, Serena, and thank you for that. Like to introduce now Alexander Nanau, who's the third panelist this afternoon. He is a German-Romanian film director, currently based in Bucharest. His latest film, Colectiv, has recently been nominated for 2 Oscars for Best Documentary and Best Foreign Language Film Award, Foreign Language Film, and has also been nominated for a BAFTA for Best Documentary. So I'd like to hand over to Alexander now, who will talk more about his work.
Hi. So I'm a filmmaker. I'm not a journalist, but Colectiv is a film about journalism and about the maybe most important investigation into a healthcare crisis and fraud and corruption in the Romanian healthcare system that followed the Colectiv fire in end of 2015. So I think that what I can contribute with is to talk about what I have learned as a filmmaker about systems and about how I found that it is almost impossible for systems like healthcare systems to reform or to become better and more performative as the political world we're living in Europe, most of all, is designed in a way that is protecting basically the failures of a system and is refusing to accept them and talk about them. And I think this is something that we learned while doing the film Colectiv, and that I think is one of the biggest threats now when we are all talking about how could we make all processes in healthcare systems around COVID more transparent. I think it will be almost impossible because the different states, once this is over and people will try to find out about all the corruption and all the irregularities that went on, we have to expect that all the different European governments will protect each other. So let's first see the trailer of the film Colectiv, and then I will talk more.
Cum e posibil ca oameni care au ieșit de acolo să moară după 12 zile?
Deci, practic, ei au ascuns lucrurile astea, da? Dacă nu spunem lucrurilor pe nume, suntem complici. Povestea e atât de halucinantă încât mi-e teamă că o să pare nebuni.
Sunt Ministrul Sănătății. Dar primul lucru pe care trebuie să-l faci ca să câștigi sau să recâștigi încrederea cuiva este să încetezi să-l minți.
Omor oameni. Nu ne putem permite treaba asta.
Și cum ne se poate rezolva chestia asta?
Și noi am avut o încredere oarbă în autorități.
Iar ce vedem aici, de când am venit, dar tot ce e sub este putreț.
În momentul în care presa ajunge să facă reverențe autoritățile se vor purta rău cu oameni, cetățeni. Întotdeauna se întâmplă asta, pretutindeni în lume, s-a întâmplat și în cazul nostru.
Yeah, so I would like to give a bit of context for this story. So basically, we had this in Bucharest, this nightclub fire during a concert. It became a national tragedy. People took to streets to demonstrate against the corrupt authorities because this club should not have functioned as it did. It had no fire exits. And basically, after 25-7 people died there, let's say the maybe even bigger catastrophe happened in Romanian hospitals when people continued to die, burn patients continued to die, while the Romanian authorities, which means the Minister of Health, together with hospital managers, and also always flanked by doctors, were basically in a systematic way explaining to this whole grieving society, nation, that the Romanian healthcare system is capable of treating over 180 burn patients, that it has the best facilities at European standards, as good as in Germany, was one of the main quotes. And they refused and prohibited the parents of these kids that were in their hospitals to be flown out to proper burn units. And they could do it because the press in Romania at that time failed 100%, and because nobody had the courage to speak up. So why the press failed? They failed because there was no specialized press in healthcare. Because if a country or a society would have really specialized press in healthcare, that press could immediately react and say, no, what the authorities are saying, even though they are doctors, is a lie. Burn patients cannot be treated in normal hospitals. They need to be treated in burn units, otherwise they will be infected. And it is a lie that burn patients cannot be transferred. They can after they are stabilized. Within the first 48 hours, you can do that, as you do it in war zones, for example. So basically, what happened was that, as expected, patients started to die in hospitals. And only when the number of deaths started to rise very high, Romania and the Romanian health authorities accepted for foreign doctors that came in also from Israel and from England, from Belgium, Germany, France. They accepted these doctors to take on some of the patients and fly them out to their own burn units. After that, it was one whistleblower, a woman, a Romanian doctor, who went to the press and revealed the truth about the reason of the death of these patients, because for sure the manipulation went on in the media, and they were lying that these patients died because of their burn injuries. But there were people with burn injuries between sometimes 10 and 20%, which is not deadly. Even patients with 80%, you can still rescue. So burn patients that do not die in the first 24 hours are pretty likely to survive if they get the right treatment. The press started to reveal what the doctor told them, and this doctor basically made her own tests and proved to the journalists that these patients were infected with hospital infections with pycyanic, and it was a very dangerous form of pycyanic. So the next abuse that happened was that most of the patients, when they were sent abroad to the clinics abroad, what the Romanian health authorities did again was they just did not fill in the files of the patients that they are infected, which meant that patients that arrived, for example, in Belgium in the Rein Astrid Military Hospital were very lucky to meet a very good doctor, Dr. Serge Jeunesse, who said, if these patients are not infected, why are they on the toughest antibiotic? I will not take them off the antibiotic because something is fishy. And they survive. In Austria, for example, at the AKH, the doctor said, these patients are not infected and they are on the toughest antibiotic. That's too tough for their bodies. Let's try to find the right cocktail of antibiotics. So some of them that were in good shape died because it took too long to find the right cocktail. Others were lucky enough to get the right cocktail in time and did survive. But taking them off the antibiotic in the first place was fatal. But how could they know? The Romanian doctors and the Romanian authorities decided not to send in the data about infection. The same thing happened in England. Dr. Sarah Pape was sent by the British Parliament, basically, to Romania. She was shocked by what she has found. She was shocked to find a healthcare system that declares that it can treat 180 burn patients, and even publicly said that no country in the world, not even the whole of Europe, can treat 180 burn patients. The investigation in Romania went on, and new whistleblowers came in that wrote the journalists that were investigating this, and that are basically one of the main characters in our film Colectiv, that told them, if you really want to know why the Romanian hospitals are full of the most deadly hospital infections in Europe, if not in the world, then I could tell you one of the reasons. And this source was working for a company that was producing disinfectants and was delivering disinfectants to 350 public hospitals in Romania. These disinfectants were diluted. This company was diluting disinfectants by 10 times. And this company was doing this since 10 years, doing business with the hospitals, doing business with hospital managers that many times manipulated the public tenders so that this company could always win them. And many times the prices were, sometimes they bought a certain amount at a certain price. The next month they would buy an even bigger amount at an even higher price. So here you could see that there was a collaboration between hospitals, hospital managers, and this company. Furthermore, what the journalists find out in our film, found out in reality, and you can see it in the film, is that the Romanian Secret Service knew this about this company since 10 years. And the Romanian Secret Service told the press that they have informed the political sphere, which means the Ministry of Health, the President, and other healthcare officials about these circumstances. Nobody reacted. Everybody supported further this company. Even while we were filming, the Minister of Health that was in power then, who now became a politician for the Social Democrats in Romania and was awarded by the Romanian president for his merits, this Minister of Health accused the journalists of being fake, of spreading fake news, and saying that they only want to close down a Romanian company, that they have foreign interests. Once the journalists proved that these disinfectants were diluted, this Minister of Health had to resign. He did not suffer much. He went back. He was a former hospital manager that also used these disinfectants. Now he is a parliamentary member and was not long ago awarded by the Romanian president, Klaus Iohannis, for his merits for the healthcare system. But it could seem like something that is contained in a corrupt country. The bigger problem that appeared, which we did not cover in the film because it was maybe too complex, is that Dr. Jeunesse in Belgium, for example, was interviewed and said that he has never seen, he described the process of being, that the patients were not brought with the right information about their infections, and the infections they have found are the worst infections he had not seen since many years. He said maybe this kind of infections exist in India. Once he did this public statement, he was forced politically, through the diplomatic channels, to take it back. So he published an open letter saying that Romania handled this crisis perfectly, that the Romanian hospitals treated these patients perfectly, and it is an impeccable system. And this is European policy. The same thing happened with the UK doctor, Dr. Sarah Pape, who first was shocked by what she has found, after which she made public statements, what a wonderful system she has found in Romania, how great the Romanian doctors have treated these patients, and that these patients were very lucky to have such a great system. And I think this is what we can expect in the next months around the COVID, around the handling of the COVID situation, and most of all about the vaccine situation. That will show, as in Romania now, it just showed that there were secret vaccine places that were reserved only for the political class, the military, and the Secret Service. There were around 200 centers opened for the ones in need, the elderly and the first-line workers, and over 300 secret stations opened for the elite and their family. And I'm sure that this happens in many other countries. This is basically what I can provide to this discussion as a filmmaker that observed these things. And I think that the problem is one of European policy. A system cannot get better if one does not admit its faults and problems.
Thank you, Alexander, and thank you for that thought-provoking note upon which you ended. And I would recommend to everybody, please do watch the documentary. It's incredibly thought-provoking. We've now got about 15 minutes for a panel discussion, and then that will be followed by questions from those of you who've submitted questions online. I'd like to start by kind of going back to the core topic that we've been discussing here, which is transparency. And certainly I've heard kind of in the ongoing COVID vaccine rollout, which is something we and many others work on, there are arguments from some quarters that caution should be exercised with regards to how much information we share or is shared with the public, and when it is shared, so as not to provoke distrust in the vaccine. And give kind of ammunition and information that could be used against the ongoing rollout to the anti-vax movement and others. With that in mind, I'm wondering if can there ever be too much transparency? And do we need to exercise caution? I'd like to open that up to the panel, if anybody's got any thoughts.
Well, maybe I want to say something. To address your point, I believe information is power, and I believe that the best antidote to fear and misinformation is transparency. You can't do public health policy using censorship, avoiding to give information. I don't think it's right. I think we all have the right to information. And I do believe, also having seen this in this field for years now, that is exactly the other way around. People, when you are afraid, first of all, you don't think straight. So you might be also led to follow strange ideas because you are in fear, and that's how the planet is right now. And most importantly, I believe that when someone is scared, unsure, and this is a lot about vaccines. I think it's not that people are just crazy or have crazy ideas. It's also that they don't know. I mean, I think we have a duty to address this with, first, a lot of empathy, listen to their questions, and give them the information, explain them what is what and what is not. But by polarizing society and saying, oh, that's wrong, we cannot say this, not so much transparency, please, I think it's going to backfire. That's my opinion, of course.
Yeah, Jonathan, I would just jump in there and really affirm what was just said. I mean, I'm not an expert on vaccine hesitancy, but I also agree that it's probably less effective to tiptoe around the importance of transparency and disclosing of information that's relevant in order for the majority of the population to understand, in fear of aggravating this particular subset of the population that is vaccine hesitant. And for those who genuinely are vaccine hesitant, you're unlikely to be able to reach them with science anyway. And so if you were to withhold information out of fear of how it might be interpreted by that particular population, you would risk, under-informing or uninforming the majority of the population.
Thanks, both of you. Alexander, do you have anything to add?
No, not in particular. I mean, I can only use again this example that we just had. The Minister of Health in Romania, the vaccination basically was taken out of the Ministry of Health and given to a military commando, let's say, so that they could basically very easily always invoke, oh, it's the military handling this, the information is secret, it's a secret of state. And so the situation we had last week in Romania was that the Minister of Health, who is a very transparent politician, decided to open the data about tests, how many people are tested and how many people are vaccinated. And only by making it open data, journalists suddenly could read in the data that something is missing. First of all, the numbers, the way they measure the number of infections was wrong, only to keep the country open. And secondly, they understood that there must be hundreds of more vaccine stations in Romania. And that's how they found out that there were secret vaccine centers. Once it was made public, what they did is they accused the Minister of Health of making secret data public, and by making it public, he put in danger strategic places of Romania, because these vaccine centers were next to military bases, which is for sure stupid, because in the same centers, the families of these people were vaccinated, from their dogs to their housemaids. So why wasn't it secret for these people? And what they did is they just, for 2 days, they cut off the access of the Minister of Health to the data. And only when the press started to write about it, they just said, oh, it was just our website, our internal system was went through maintenance. That's why the minister had no access. So there's a lot of secrecy and a lot of corruption, basically, about the vaccine rollout.
Thank you. And one thing kind of, I think, well, that you picked up on, Alexander, and Sarah, you mentioned, was the kind of corruption in procurement. You mentioned the kind of the bleach and the disinfectant, and we've seen it in the UK across the kind of the rollout of the last year, the procurement of PPE, protective equipment, etc. There's been great opportunism, corruption. We call it chemocracy, which is apparently the in thing. But at the same time, we say our society, kind of in the UK, the health system is pretty corruption free. I wonder what you think. What do you think? Kind of will there be a legacy from this pandemic? Will it help people better understand some of the kind of intricacies and complexities of the healthcare system and the vulnerabilities? And what do you think we can do to make it come out of this pandemic with a more corruption-free health system? And perhaps turn to you, Sarah, as you've kind of got a global perspective on this.
Sure. Thank you, Jonathan. So I have a few things to say about that. I mean, I really feel that the COVID-19 pandemic has started to sort of shift gravity. So more people are more informed or more aware of the importance of the health system. I think prior to, for those countries where there were and are like well-established systems, it was really taken for granted. Sort of it's just part of the functioning society. But COVID has really demonstrated that it's not something we can take for granted. It's something that is fundamental for the functioning of every other aspect of society. And that when it becomes overrun, then other elements of society can't function, particularly our economic activities. And so I think that it's really shifted gravity, and people are just much more aware of its importance. And they're much more in tune with what is kind of going on, or what functions health systems do carry out, and the threats that exist to it, not just corruption threats, but the pandemic is a threat to its functioning. I think there's also an increased awareness, or at least an increased attention to the pivotal point that the pharmaceutical system plays in health systems. And I think there are more questions coming from people about, first of all, asking, why is the system built the way that it is? Is it functioning in the way that we need it to? And then I think built on top of that, there is a budding increase of awareness and appreciation for the vulnerabilities that health systems have to corruption. And the kind of importance of health funding and the concerns around funding shortages and things like that. On the same side, or on a different side, but similar to this, is I think there is a risk that with this increased awareness or consideration for corruption vulnerabilities in health systems, that without a solid understanding in the public of what constitutes corruption, that there may be a risk that any sort of dissatisfaction with the service could be conflated with corruption. I think there needs to be maybe a teasing out among the public of what actually constitutes corruption and what sort of investigations or what sort of information is required in order to understand what constitutes corruption in the health sector. And then as far as sort of what we can do going forward, I think it's a general concern for those working in my field that there's just simply not enough funding and attention being paid to addressing corruption, for prevention, for detection, and for sanctioning corruption. And it's because of the lack of prevention, detection, and sanctioning of corruption then that we don't have, people are more likely to continue to be corrupt in the health sector. So I think that's I'll finish there and let others contribute.
I think if I could jump in there, what we see, for example, in Romania is also the judicial system is very, is not performative when it comes to the healthcare system. They really don't go. There seems to be. I talked to different people, including who is now the head prosecutor of in Europe, Laura Kövesi. It's a new office in Luxembourg that is looking into the corruption of the different European states, and she told me that even with prosecutors, there is a feeling of should I really, bring down doctors or bring down healthcare officials? More so in a country and in times when even a prosecutor does not know when he and his family might need hospitals and a doctor, and he might want to make a phone call to get better treatment or to get better access. So it's really a circle of private corruption, of a corrupted attitude, let's say, and bringing that into your profession as a prosecutor. And the doctors know that. They know they are God.
Thanks. Serena, do you want to add anything? Or
Well, maybe shortly, just that I believe that there is, of course, I agree that there was a lot of attention on public health systems, chronic problems, I would say. Maybe it would be great if there would be more reflection and more in-depth analysis of what is the system, how is the system working beside this emergency. I haven't seen enough of that, I have to be honest. Some things have been a bit communicated to the general public as this would be just like unique and exceptional, whereas we know that many problems are really chronic. So presenting this always as an exceptional, unique thing, I think is not a good service in the public interest, because you could always say, we could always say, we want to have a conversation as a society. Do we agree that this works this way, this functions this way? But by presenting this, okay, this is the emergency, maybe we are not going deep enough in that conversation. And I think that then the stakeholders that are holding the power, they can just celebrate, because we are not really addressing the chronic problems around corruption as well, of course.
Thanks, Serena. I'd like to open up the discussion now to some of those that we've been getting from those of you listening in. So I will hand over to Tatiana. I think we'll read out the first.
Yes. I have actually a lot of questions for you from the audience. The first question I would like to ask Serena. Could you tell us a bit more about the British Medical Journal article that was published? You were working on the discourse of the email leaks investigation. Could you tell us more how this investigation went and what were the results?
The British Medical Journal piece core focus is about transparency, because we have been delivered, like many academics and investigative journalists worldwide, this hacked material. Nobody of us know exactly who has been hacking. I mean, there are many things we just don't know. But these batches were delivered to several people. And it's quite a lot of material, because it's 40 megabytes of confidential correspondence. So there are emails and there are many, many documents. And it's all extremely technical material. And it's kind of a picture in time, because it's in November 2020, as the European Medicines Agency was really working really hard to try and get the Pfizer-BioNTech vaccine authorized. Maybe it's useful to remember that there is a difference between approval and authorization. All the COVID-19 vaccines are authorized. We talk about conditional marketing authorization or emergency authorization. So it's a different procedure. It's a lot of material. The European Medicines Agency has confirmed at the end of January that the material is genuine. And this was, of course, very important for us, because, I mean, we don't want to work with doctored material, although the agency specified that this we have seen, or when we have seen the material, there is a choice in assembling. There are some titles that EMA say they were not there, but the core of the emails are genuine. The piece is about transparency, because by doing this work, we asked many questions to all the regulators, to the companies, because this is not only about Pfizer, BioNTech, it's about all the mRNA vaccines. And we found out, and that's the main finding of my investigation after all, is that nobody wants to say what is the percentage of integrity of this RNA molecule. It's a very complicated story. The BMJ piece is in open access and is not jargony. I think everyone can read it, actually. But in a nutshell, to keep it really simple, everyone knows that with this technology that is super promising since 30 years, the RNA fragility is the problem. It's the only problem you probably have with that, because it's so delicate. So through this hacked material, we could see that there was a concern about that in the early days. So with the first commercial batches, apparently there was a problem with this amount of untouched molecule, let's put it this way. So we asked everyone, the European Medicines Agency, the FDA, the Canadian authorities, all the companies, what is the percent that we can assume then it's okay? And everyone told us that this is a commercially confidential secret. And that's a problem, because we need the medical and scientific community to participate to this process. It's in the public interest. So if we don't have the information, if they don't, because of course I wouldn't be able to assess this. I'm only an investigative journalist, but there are many, many, many valuable scientists worldwide, and they could contribute to this in the public interest. But if we don't have transparency, that's just not possible. So that's in a nutshell what came out of this story for us.
Thank you, Serena. I have also other questions for others. Of course, if you feel also to answer to the question of each other, just interrupt me and let me know if you have something to say. There was a question for Alexander, and especially related to the discourse of your film and how you were collaborating together with investigative journalists to make it possible. So could you tell a bit more of how you work in the film with journalists, especially doing investigation, and what was your relationship with these teams?
Yeah, so basically the way I do documentaries is in an observational way, which means that it's crucial for me to find people that are fine to be followed in their everyday life and work, most of all, like in the case of journalists. And when we first approached this group of journalists in Romania that were investigating the healthcare system, they denied the idea because they said a newsroom has to stay protected. We have to protect our colleagues. We have to protect information and our sources. But then they gave it another thought, and at a certain point they called me and said, like, listen, we are onto something, we could try. So what I did from that moment on, I just shadowed their work. That means I was there in the newsroom with my camera, sometimes with a sound person, and I would just follow them. I would follow them on stakeouts, I would follow them on press conferences, I would follow them in the newsroom while they were having their meetings and trying to make sense of things. And the crucial thing was we really wanted to see how it works when journalists meet whistleblowers. So what we did, they would tell us, like, tonight whistleblower sources would come in. You have 5 minutes to explain to them. If they want to be filmed, it's fine. If not, please leave the newsroom, let us do our work. So basically what we agreed with the whistleblowers that let themselves be filmed was that we will go on shooting this film for another year, then maybe edit for a year or maybe longer. So we will release the film only in 2 to 3 years from now on. And if you agree to be filmed, what we can promise, and also that was their right, basically, we said, once we finish editing this film, we will watch together the scenes with you. And at that moment in time, you can decide if you want to go public, basically, as being the source of this investigation. Luckily enough, the women that were the whistleblowers were courageous and agreed to appear in the film.
This is just a technical question for you. People are asking how it's possible to watch your film, if it's available, not only Germany, but also other countries, and specifically also if in Romania has been widely distributed, and what was the response of the Romanian people about it?
So I'll give you just top of my head the fast answer to where it can be screened. In the States, on multiple platforms, you can find on the Magnolia Pictures website all the addresses, but you can, it will go to Hulu very soon, I think on the 21st or 25th of March. In Italy, you can watch it on iWonder platform, so you'll find it with a search. In Germany, you find it in the ARD, MDR, Mediatek, and you find it in all HBO Europe countries on HBO Go. In Romania, we had only 2 weeks in the cinemas before they closed down because of the pandemic, and we had a really high number of admissions, but most of all, a very young generation. So most of them were somewhere between 16 and 30, 35. So it was really the generation that needs answers to, is this society, can we change this society that is still governed by corrupt and incompetent politicians? And what happened then, the film went on to HBO Go, where it became the most watched film of the year. But the more interesting thing is that, and what we know from the journalist, is that once the film was published, the number of whistleblowers went up by 10 times. So if they had, before we launched the film, around 10 valid leads per day from sources, once the film was published, that one went up to 120 per day, which sometimes even became a problem for the newsroom because it was just too much information. But it's a huge number to have so many valid leads per day. And even now during the pandemic, a good part of the investigations are for sure also started by people that, not only the people that see the film, but I think also the people that read about the film and read about the whistleblowers and their courage, and basically understand that you can change things. if there is good investigative press together with courageous whistleblowers, you can really bring down corruption.
Thank you. And there is also a question for Sarah. There is an initiative called the Open COVID Pledge to fight for more open license IP. Could something like that help, even if slightly, on what other action could be taken to improve the situation?
So thank you for that question. I'm not familiar with the Open COVID Pledge specifically. I'm guessing that it's built on the similar premise of the Medicines Patent Pool. And I mean, as I said in my presentation, there is an incredible opportunity simply because of the amount of public funds that have been invested into these innovations for COVID-19 to demand that they are made into public goods. Now, should that not occur, I think another sort of opportunity is to increase the amount of funds or to ensure that an element and a level of the royalties or some sort of agreements are made with the manufacturers to increase the amount of vaccines that are being manufactured for the COVAX facility. It's not acceptable that 20% of a country's need is being covered by COVAX, and there hasn't been increased pledged amount of fund to be able to close that gap, or that countries whose health systems are already struggling should then have to cover the additional 80%. And it's not because I don't think that these countries should have to invest in their own health systems. It's just it's not feasible for them. And it's going to increase the scarcity. It's going to just allow for there to be less availability of vaccines to widen the gap between high-income countries and low and middle-income countries. So if we can't find a way, I mean, and again, as I said, it's a political decision. If we cannot find a way to make these innovations into public goods so that they can be more widely available, then there needs to be more investment made into those other types of mechanisms that are working to try and close the gap.
Thank you. And connected to that, there is another question to Serena specifically. On the coverage of the EU vaccine rollout, this person says, surely the last week has been a terrible example of accurate journalism, I think, like ironically. Would be interested in your opinion and also the other people in the panel.
I think it's very depressing. And again, I totally feel for all these journalists that overnight had to improvise it, but it's getting a bit really too much, because I think for people that maybe don't have much knowledge how vaccines are developed, how the process that regulators do, how do you assess adverse events, all this kind of journalism is extremely confusing. So yes, I think we have a problem. Yes.
I don't know if the others want to add something on this. Otherwise, there is another question that we could use to end the conversation. But of course, if you have anything to add, okay, from the silence, I understand not. So the last question to everybody that I think maybe is going to make us end the panel on a positive note, hopefully. This person is saying, in a moment of crisis, along with the huge risk of corruption, there is also a chance for opportunities, like positive change. Do you agree? And if yes, can you mention one specific positive change that can happen?
I can just jump in here. I think that what we see now is basically what we also see regarding the public awareness of politics. Once we were in a crisis, beginning with 2016, be it the manipulation that took place before or during the whole Brexit campaign, be it the Trump administration, Bolsonaro, all these populists that took over and started to dismantle democracy, and we started to understand where the danger lied, we could see that more and more people started to not only become aware, but really learn about the mechanisms of politics, how they really can influence their society by voting, or how the political systems of different countries really function. Who do you really vote for? What is their system? Is it a parliamentary system? What kind of a system do they have? And I think this happens also now. People become more and more aware and really aware of what a healthcare system means.
And do you want to add something also, Serena and Sarah?
Sure, I absolutely agree with what Alexander was saying, and I think it's increasing. It's actually kind of there is an opportunity here based on the momentum that was generated in the years before, and I think in addition to what Alexander was saying is within the public health community, there's a lot of talk about the sort of the colonization or the impact of colonialization on public health, and I think we're seeing that play out in very, very much in the vaccine rollout, and just generally we're seeing that the consequences of the sort of global economy and the way that everything has been designed is sort of coming to the fore in the COVID-19 pandemic, where the inequalities and the gaps are just so extreme, and it's become very apparent. And so hopefully one can use the momentum around sort of the political engagement of just regular people and of journalists, of media and other actors to use this to be able to kind of come out on the other side of the pandemic with ideally sort of more a just society, ideally.
Give us the last comment.
Well, I really agree with you, of course, and let's be optimistic. Of course, let's close on a positive note. I really think we should all really defend the right for people to ask questions, the right to have full access to information, of course, explained in terms they can understand. Otherwise, we are reproducing an unjust society where only someone has access to information or can read them or understand them. So a more inclusive society would be great and less polarized. So I think we all have some job to do there, to keep the conversation going and resist to the temptation of self-censorship or censorship, or saying, no, it's good, they don't speak, because you never know. Let's keep this as an open society as much as we can. That would be my wish. Thank you.
Thank you, Serena, and we will keep the conversation going with you tomorrow, because we will have the panel with you. The workshop with you. I just remind the people that are listening today, they can still subscribe to your workshop that is tomorrow from 3 to 5. Get your numbers straight, making sense of health data. So we will go on discussing with you about all the things also that we have to solve in this situation related to misinformation and pandemic journalism and so on. But so I really want to thank all of you, because we are at the end of our conversation. Jonathan for the moderation, and Alexander, Serena, and Sarah for your great important contributes. So thank you very much for this. And I also would like to announce what is coming after, because today we go on with our conference. We will meet you again at 6:30 Berlin time with the panel Voices of Care, Exposing Dangers to Public Health, together with Delphine Halgand, Yvonne Delmark, Helen O'Connor. And then also very important, tomorrow morning from 11 to 1, we have also a panel that I consider very, very central in this time, Julian Assange, Repression, Isolation and Lockdown. And we will speak about the situation of Julian Assange, his conditions, and what we can do to improve the society around truth teller, whistleblowers, and people that are really risking to bring the right information to the public. And this panel will be with Sulet Dreyfus, Jennifer Robinson, Stefania Maurizi, Felicity Ruby, and is moderated by Anna Myers. So thank you very much, everybody. Really, thanks. Has been a very interesting conversation. And we will see with the public at 6:30. See you. And remember also that it's possible to watch the film Coronation from Ai Weiwei until Sunday. For the people that are in Germany, you can just go on our website and get the free access to watch the movie. Thank you.